This video will cover the diagnostic criteria for classical-like EDS, a subtype of Ehlers-Danlos syndrome. CL-EDS is a rare form of EDS, with 1 in 1 million experiencing this subtype. The genetic testing is quite new to defining this disorder, and many individuals may have previously been diagnosed with classical EDS as the criteria are quite similar. Roughly 0.5% of EDS patients have CL-EDS. Approximately 70 to 90% of all EDS patients are assigned female at birth. We are going to review the new 2017 diagnostic criteria for Ehlers-Danlos syndrome. The formal evaluation and genetic testing are required for a diagnosis, which include major and minor criteria. Skin biopsy is mentioned below, but is rarely used as it can only rule out other types of EDS. The major criteria for CL-EDS includes stretchy skin, velvety skin, easy bruising, joint hypermobility, and an absence of atrophic scarring. Hypermobility is evaluated by the Beaton scale, which will be discussed in another video. It is essentially having pathogenic flexibility of the joints, allowing them to have a higher than normal range of motion. Minor criteria include edema in legs, mild muscle weakness, prolapse, severe fatigue, axonal polyneuropathy, muscle weakness and pain, and atrophy of muscles in hands and feet. Edema refers to swelling which is usually due to fluid retention, which may be in the form of blood, water, or lymph fluid. A prolapse is when an organ shifts in place because the supportive ligaments are not strong enough to hold it up. Axonal polyneuropathy suggests that multiple axons in the nervous system are not functioning how they should. This often leads to neuropathic pain or delayed or impaired nervous system responses. Finally, atrophy essentially suggests muscle wasting. More minor criteria are specific to the feet and hands, including pysogenic papules, pes planus, flat feet, broad forefeet, brachydactyly or short toes and fingers, and acrogeric skin of hands. As you can see in the picture on the right, acrogeric skin looks like aged skin. CL-EDS also has genetic criteria and has autosomal recessive inheritance, meaning a child needs both genes to get CL-EDS. There is a 25% chance of passing on CL-EDS if both parents are carriers of genes. There are 2 potential genes that lead to a CL-EDS diagnosis. The TNXB gene has 2 copies of mutations, homozygous, and patients may have large gene deletions with additional symptoms. Sometimes the CY2P1AM2 gene is also mutated, which is associated with congenital adrenal hyperplasia. If persons have only 1 mutation, heterozygous, they may have symptoms similar to EDS hypermobility type, including joint hypermobility and soft skin. TNXB is the more common mutation. This gene instructs the body to make a protein, tensin X, which organizes and maintains the structure of tissues that support the body's connective tissues, including muscles, joints, organs, and skin. This protein regulates the structure and stability of elastic fibers, which provide flexibility and stretchiness, elasticity, to connective tissues. It also helps regulate the production and assembly of collagen, which strengthen and support connective tissues in the body. This is the end of the diagnostic criteria for CL-EDS. Please click the like and subscribe button if you'd like to learn more about Ehlers-Danlos syndrome and other rare conditions. You can also follow me on Instagram for more regular posts at chronic.care. Thanks for watching. Stay rare.